What are the 5 signs that you really need to seek surgical attention for your back? A lot of times our brain will go run wild on us and it'll think this has to be so serious that I can't just do physical therapy. It's not going to get helped with exercises or manual therapy. And so we're going to line those out. What are the 5 major things that we see when we say, hey, this needs surgical attention, and when we send them out? Let's get into the video. Right out the gate, red flags. You need to seek medical attention immediately if you lose control of your bowel system. If you have unexplained weight loss, it would happen fairly quickly. If you have fever and chills, night sweats, anything like that, you're gonna wanna seek medical attention immediately because those are really extreme problems. We don't see it very often, but it's something to pay attention to. Also, a history of cancer. You wanna get things checked out. If you have a history of cancer, you wanna make sure that nothing like that is coming back again. Number 2, when we're looking at physical therapy, we need to have a mechanical change. What a mechanical change means is that by movement, we can make it better or worse. If we can't make it better or worse by movement or lack of movement, then we know that it's a systemic problem. So you should be able to assess whether moving around causes problems, side bending, bending forward, extending back, sitting down, standing up. If you lay for long periods of time and it's getting worse during that time period, those are changes that are happening. And so we want to have mechanical changes. We know that if it changes with movement or changes with lack of movement, then it's likely something that we can attack on the physical therapy side, manual therapy, chiropractors, if you're into that. So any professionals that are at a high level of service, a high level of expertise, they can attack mechanical change. So pay attention to movement patterns and things that really cause your pain to get worse or to get better. Number 3 is something that we've seen quite a few times here in the clinic where somebody gets better, they're feeling better, everything's moving better. They can get up, they can sit down. We had a guy that came in for 19 days. He was laying down on his stomach or on his back. He couldn't stand up. We immediately, within the first week, we got him up. He texted me and let me know that he was eating dinner with his family and how impactful that was. But then when he would go for a walk, he started having this little foot slap. His foot was dropping down. We call that drop foot. So if you start having a problem with motor control of a nerve, if the nerve's not getting that motor control and a muscle is losing function, that's something that we seek medical attention. As soon as we found out about that, he had good results. He had mechanical change, but then he had a problem where he had lost motor function in his foot, and that's that L4 nerve root coming down to his leg, and that's gonna be something that's not gonna come back very quickly if you have it compressed for too long. So we immediately referred him out to make sure that he talked to a surgeon, and we confirmed it that L4 between L4 and 5 was being compressed on that nerve, and it was too big. The inflammation couldn't be taken down, and he ended up having to have surgery for that. And so we're looking out for those things. Even when we get good changes with clients, they're feeling better and moving around. If we have a motor problem, then that's something that we always want to refer out for. Number 4 is muscle wasting. Muscle wasting, I've had this happen before. We had a client that came in and he walked in and his leg was about half the size of the other leg. So his right leg had shriveled up, and it had happened within a week. So muscle wasting is something that people will talk about. They'll be very concerned about it when they talk to me. They'll say, I feel like I'm losing the muscle in that leg. Well, muscle wasting is dramatic. So that happens very quickly. It gets very shriveled up. It's because we have a motor control problem and we're being compressed too much. And so that muscle is actually wasting away. It's not just a little bit of a difference. So if you're having muscle wasting, if you're losing muscle very quickly, that is an absolute seek medical attention. You need to find either an ER or go to a physician. And this is not medical advice that needs to be watched concretely. This is what I'm seeing in the clinic. And I want to be very honest with you guys that you need to seek medical attention. If you're having muscle wasting, if that muscle is disappearing, that doesn't come back. We want to make sure that we get surgical attention as quickly as possible. Find somebody that you trust that'll give you real information, but that muscle wasting is very serious, and we absolutely draw a line right there. Number 5 is shooting pains. So typically shooting pains in the nerves down the leg that don't change. So sitting down and having shooting pain going down, right? So it's not a constant pain. It's not numbness and tingling. It's like a sharp shooting pain going down the leg that we can't change. We're in a standing position. It just keeps shooting. So we've seen that where it was stenosis in a client and they were making progress, but once they got that shooting pain happening, we said, hey, we need to talk to a surgeon. We need to get a look at exactly what's going on in here. Even though the surgeon had referred him over and didn't want him to have surgery, who was a younger kid, we didn't want him to have surgery. The surgeon didn't want to have to do it. But when he started getting that shooting pain down his leg and it was incessant and it wasn't something that we were able to change, then that was something that was a red flag to us. We sent him back out and he did end up having to have surgery. He had stenosis, which is narrowing of that canal, and he had compression on that nerve root. And that shooting pain is something that we want to watch out for. So we want to make sure that we're getting medical attention at that point. Subscribe to the channel for more videos on exactly what we're seeing in the clinic, what's working with our clients. We'll show you exactly how to fix the majority of these problems. We'll also tell you what to look out for and make sure that you're seeking the correct medical attention. To summarize, anything red flags, unexplained weight loss, fever and chills, history of cancer, those are things that we want to immediately seek medical attention. If you don't have mechanical change with your pain, if you can't make it get better, make it get worse, that's something we would refer out to as well. If you're having drop foot, if you're not getting motor control in a muscle, that's something referred out. If you're having muscle wasting, if that muscle's shriveling up, absolutely, we refer out. And then last thing was shooting pains. Those shooting pains that are persistent, that are causing us problems and we can't get rid of them. Those are things we refer out immediately. We want to seek medical attention. Always getting as much information as possible for your injury so that we know we're on the right path. You know you're working with the right people, the right medical professionals, and you're getting the best level of function back. We don't want to take too long with a lot of these things, because if you're having muscle wasting, if you're having motor control problems, a lot of those things take a long time to come back, and the muscle wasting oftentimes doesn't come back. And so we want to make sure that you're being safe out there and you're making good decisions. If you found this video helpful, like, comment, or subscribe. Let us know exactly what you need information on, what problems you're having, how you want to be able to fix it. We'll see you in the next video. Get mobile and stay active.